So what brought you into Friendship Heights Chiropractic?
I have multiple sclerosis, and I've been dealing with it since the late 70s. And I have a neurologist up at Johns Hopkins, who's the head of the department up there, the neurology department. And he and I have talked about a protocol that involves medicine and exercises and building up the core, strengthening the core. I swim half a mile a day. I do all types of exercises, but a few months ago, before I started with Dr. Connelly, I had a lower right back problem because of my gait, because of the MS. So there was a catch-22. I was dedicated to doing all the things I needed to do to balance out and fight back on the disease, which primarily affects my mobility in my right leg and at times my arms. And so I had this pain in my lower right back that was affecting my ability to do the exercises and all the different things that I needed to do with physical therapy to deal with the MS. So I had a dear friend who had come to Dr. Connelly for his back problem, and he recommended that I give it a shot. So I came over, and almost miraculously, within a few weeks, coming and seeing Dr. Connelly for 20 minutes a day for 3 days a week for 2 or 3 months, the lower right back pain problem was gone, and I was able to do the things I needed to do to fight the MS. And one additional thing is that I had been using a cane and a walker to get around, and Dr. Connelly sort of saw me with the cane one time and said, "Why don't you use a hiking pole?" So I went and invested in a hiking pole that, instead of like a cane where you're leaning down and pushing, or even a walker where you're leaning down, the hiking pole has you pull up and you keep your back and your spine straight. And that, combined with what I was doing, and I'm now down to doing it 20 minutes a day for 2 days a week, I am aligning my vertebrae and I'm keeping my spine and back straight. And it has been a significant contribution to my MS situation, to the point that my neurologist, a couple of weeks ago, I had my latest appointment, he said that you went from relapsing remitting to secondary progressive, and now with all the things that you're doing, you've incrementally improved for the first time.
Fantastic.
And so I attribute a lot of that to the kind of things I'm doing with Dr. Connelly.
Excellent, excellent. Thank you so much. That's awesome.
Well, it's a fascinating story, and what's fascinating also, or interesting, is that the neurology department at Johns Hopkins, headed by my doctor, Dr. Justin MacArthur, are very fascinated with what I'm doing, because I seem to be reversing the trend, albeit incrementally. And again, I attribute that to what I've been able to do here with the chiropractor approach, but also with the swimming and the medicines that I take and the other physical therapy that I have been able to do because my back is not a problem.
Excellent. Thank you so much.
Sure. Well,
Appreciate
thank
it.
you.